All right. Hello, everyone, and welcome to today's webinar, Everything You Wanted to Know About NASHIA's National Collaborative on Children's Brain Injury and the Special Interest Group, hosted by the National Association of State Head Injury Administrators. We thank you for joining us. I am Maria Crowley, NASHIA's Director for Professional Development, and I'm going to be your moderator for today. Closed captioning is available. If you're familiar with Zoom, you know that already. You can enable that at the bottom of your viewing window. If you need assistance at all for today's webinar, please send us a chat. Questions for the presenters you can also add to the chat, and we can address those as we go, or we can address those at the end of today's webinar. If you're not familiar with NASHIA, we're a nonprofit organization that's been created to empower state government and our partners to enhance collaboration and strengthen capabilities to address the needs of individuals with brain injury and their support systems, and we take that very seriously. In addition to numerous training opportunities that we offer throughout the year, we also offer support and technical assistance and consulting services. And we would love it if you would consider joining our organization if you're not a member already. We have a lot of benefits and we'd love for you to enjoy those. Speaking of benefits, we have a new benefit this year. It is the NASHIA Training Pass. It gives you an opportunity to save on our workshop registrations, and it's not too late to access that. Just email us for more information. Certificates of attendance and for social work CEs are available with our webinars. And you can see that the slides will be available later today. I'm going to put them in the chat as well once we get started. The recording will be available after our webinar also. You'll see how to access those from the information that is here. Those things are available for free or at a reduced cost for our members. And all you have to do is fill out the evaluation at the end. I'll share that as a link in the chat. And you'll see that in the slides later on. And now I would love to introduce you to today's presenters who are going to share a little bit about our special interest group and their passion for children and the field of brain injury. Jennifer Lundeen is an associate professor in the Department of Speech and Hearing Science at The Ohio State University. She's a researcher as well at Nationwide Children's Hospital, where she formerly worked as a speech and language pathologist in the pediatric rehab unit. Her research focuses on improving gaps in access to and utilization of services of support for children with acquired brain injury, and on identifying specific approaches to improve assessment and treatment practices for children. Brenda Egan Brown is a state director for Pennsylvania's Brain Steps Consulting Program. It's nationally recognized. I'll bet there's not a one of you that hasn't heard of it. Brenda's been a part of the school system for a long, long time. As a teacher and a brain injury specialist, she serves on the Board of Governors for the Academy of Certified Brain Injury Specialists, the CBIS program, and is on the Board of Directors for International Pediatric Brain Injury Society. Melissa McCart is the director at CBERT, which is the Center of Brain Injury Research and Training with the University of Oregon. I know you know about that program as well, and is a researcher, speaker, and author on return to school following brain injury. She focuses on educator training, best practices, and educational policy. Prior to being a part of CBERT, she spent 17 years as a teacher and a school administrator. So you're going to be hearing from three ladies who know a lot about brain injury in children and youth. So welcome.
Thank you, Maria. I'm going to kick off our session today. So could we go to the next slide? There we go. All right, next slide. So we're going to talk about the National Collaborative on Children's Brain Injury history, because now we are the NASHIA collaborative on children's brain injury. So we wanted to talk about where did this come from? And the whole purpose of us being here today to talk to you about this group is because it is a very active group. We're working on projects that really can have a national impact, and we want more people to join our special interest group who really want to work and make a difference nationally. So the history is that it was a national collaborative group looking at ways to improve services and supports for children with brain injury. This is what our purpose is. Our current focus is on improving educational services for students with traumatic brain injury. And we have 3 goals of this special interest group. First, to identify critical gaps in educational services. Second, to make policy and research recommendations. And third, to share information, tools, and resources on what supports are available from all of our different states for children with brain injury in the school setting. Am I supposed to be moving these slides? I'm sorry. Okay. So the history, it began as something called the Nittany Group, which was just an informal name, because the first meeting that we held was a brain injury summit in State College, which is where Penn State is, hence the name Nittany Group. It was held in State College, Pennsylvania in August of 2011. And the goal of bringing this group together was that there were some people who were already coming into Pennsylvania to speak at a Department of Education conference on brain injury. And so there were several of us that started talking about how could we pull in more people from nationally to the same location to really start digging into what are the common data elements across existing TBI school consulting programs, like the one in Oregon, like CBERT and Brain Steps. So we had professionals come in from all over, and we talked about school and educational outcomes. Next. We had representatives present from state departments of education, HRSA grantees with relationships with their state departments of ed. We had someone from the National Institute on Disability and Rehabilitation Research present. We had state directors of brain injury school consulting programs present and researchers in pediatric brain injury. The purpose was to conduct a high-level assessment of accomplishments, needs, and gaps regarding children with brain injury in educational settings. We had some primary themes that emerged, and they were consistent with themes that have been talked about for the last 30, 40 years. So some of those themes were the under-identification of children with brain injury in the school setting, lack of coordination for transition, whether it's from hospital to rehab or rehab to home or school and community. There was a lack of training for school personnel, both at the college level for teachers who were at the pre-service level wanting to become teachers, and also at the in-service level. So once they were hired as teachers, they still weren't getting that training in brain injury from their school district. We determined there was a lack of evidence-based practices in working with children after a brain injury and lack of funding to support these initiatives. So the group decided to write up these findings from this meeting in various white papers, which were then published through NCCBI. One focusing on mild traumatic brain injury only, and how states can build their infrastructure to support students with concussion or mild TBI, and also one that focused more on moderate to severe TBI in students in the school setting.
And Brenda, we also did the review of college syllabi, looking at did they actually teach anything on brain injury and found that mostly no, there was nothing taught to teachers.
Thanks for adding that, Melissa.
Of course.
Sadly enough, yeah, that was a sad finding. So, but it went along with why these primary themes were remaining after, years and years. Okay, next. So after the summit, other groups nationally were starting to focus more attention on children and brain injury. And there were task forces forming and committees forming on national work groups. So NCCBI decided they would like to merge all these efforts of all of these groups into one collaborative rather than all of these little groups popping up everywhere working separately. There's power in numbers, so let's bring everybody together. So the first actual meeting of the National Collaborative on Children's Brain Injury was held in March of 2012. It represented a grassroots effort, and the purpose was to develop recommendations for building statewide capacity to support students with brain injury. And from this, many projects emerged. Next. So although we knew that there were these significant gaps across all service domains for children after a brain injury, the NCCBI's goal was to focus on community, family, and rehabilitation issues and how they were related to school services after a child had a brain injury. So NCCBI then continued on to identify critical gaps in educational services through various work groups that were formed, make policy and research recommendations, and then share information, tools, and resources. Next. So NCCBI membership. The NCCBI membership included for several years family members, state departments of education staff, state lead agencies on brain injury directors, federal agency staff like Department of Education, National Brain Injury Organization leaders, and researchers. And it was just this group that was formed. We weren't part of any other, organization at this point. And we talked in our work groups about what can we do to make a difference. And we'll talk a little bit about that in a few minutes. Next. So what happened before NCCBI became a special interest group as part of NASHIA? We had work groups that were writing papers. We had a work group that was looking at, we sent out a preliminary survey to state departments of education. We did not complete that project, but it is something that we may reinitiate now under the special interest group. But it was a tool that was sent to special education directors of states to ask questions about what exactly is occurring in their state for children with brain injury, because we wanted to look to have them really think about and reflect on what are they doing, what could they be doing. But that project did not finish. We also had an online resource. What was that called, Melissa? Online, or why can't I think of the word? It was an online database hosted through CBERT.
I forget what we called it, but it was
Yes.
basically a collection of everyone.
Community of practice, right?
Thank you. Yes, community
Okay.
of practice. It was basically everyone's best work and all the things that people could use as resources, as well as a blog where people could get on and ask questions.
Mhm. So, and what else did we do? We had many papers, several papers published. We had our tool that we were working on. Well, all that to say that we did not end there. And we now are a special interest group as part of NASHIA. And we are still working on the same projects per se, but we have specialized more now into the policy side of things. So next slide. And this is when we were a special interest group. Sorry about that. So in 2022, NCCBI decided we needed to really be in with a national group specializing in brain injury to provide more support, organization, and members to the NCCBI group. And so after we looked at different national groups that were out there, it was determined that NASHIA was the best place that we would like to fit NCCBI under. And luckily, NASHIA was happy to have us. So the NCCBI group became a special interest group officially. And we now have 2 official work groups. And those work groups are policy focused, whereas before we weren't just policy focused. Now we are policy focused. We're moving forward. And the next section, we are going to talk about what those 2 work groups are doing.
And I will say, I think part of the logic behind combining the groups was that it's a small community working on all this, and it created less fragmentation and more collaboration for all of us to be in one space with NASHIA.
Yep. Okay, next slide.
Thanks, Brenda. Haley put some information in the chat about joining the special interest group, so please check that out if you are interested. And I'm going to share a little bit about the work groups that we have going. Since NCCBI started, and Melissa and Brenda and I are working together as co-chairs, just trying to kind of keep things going and put ideas together and try to figure out how we can move these ideas into action. So we developed these work groups from our initial NCCBI meeting when we joined NASHIA and took the members that had previously been a part of NCCBI and then new members who also joined with that integration. And we had leaders who self-identified to help lead our group. So we were very intentional that Melissa and Brenda and I, wanted folks who were willing and able to help do the work. Excuse me. And so we had leaders self-identify to help run and actualize the group project ideas. And members then chose one group or the other to belong. And we'll talk about each of those groups moving forward. So Maria, can you forward for me? Thank you. So the first work group is the standards of practice. And we want to give a little shout out to the leaders of this group, Jody Dickerson, Karen McAvoy, and Tony Grisham, who have done an amazing job pulling ideas from this work group. So we had several meetings where folks shared information and completed Google Forms and dug into their own states to try to identify the existing brain injury questions that were in health history questionnaires for schools that happened at point of entry for students going into school. So maybe kindergarten or high school, or at transition points. So when students might be screened and have to complete a health questionnaire. And we started by surveying what existed. So here, other members of the work group participated by giving information that they knew existed in their states or their school districts, and we compiled information and took those existing tools and considered what other questions we thought needed to be asked. So again, Jody, Karen, and Tony did a lot of work leading this in the background and then in the forefront as well. Next slide. And they've created a shared form, which is not quite ready for prime time yet, but it's very close, and I can show you some snippets of it today. But just before we do that, just to know that, again, please don't take pictures of them. We will be sharing this and helping to disseminate it to everyone. We're just in the final touches, or putting the final touches on these forms. And as they created this form, we realized that we had lots of questions that we wanted to ask families, specific questions about different body systems, but including brain development and brain injury, and then also asking about immediate and persistent changes if there was a history of any type of injury to the brain or developmental brain diagnosis, and also looking at behavior and cognition. So sometimes, things that we might see in schools, but people might not necessarily be linking to a prior injury to the brain. And what we realized when we took this to our larger NCCBI group is that we needed a shorter form as well, that this form is very extensive and might be useful if you were doing an IEP meeting, for example, but we needed a shorter screener to make this form more accessible and useful. And so that's what we're still working the kinks out on. Maria, will you forward for me? So here are just some little snippets from the form that Karen and Jody and Tony compiled. So asking specific neurologic related questions about seizures, and then also, have they ever been seen in an urgent care, emergency room, hospital, or by a doctor because of a concern for a head injury? So again, not just calling it traumatic brain injury, but more loosely, and also noting that families might be seeking care at different points of care or points of entry into the healthcare system, and not just asking about hospitalization or emergency department visits. On the right, in the purple, you can see some of the specific questions relating to any behaviors or struggles that they might be having since their head injury. So if in fact a family endorsed having an event like that, then we would ask more questions about any changes that happen immediately, but also persistent difficulties that they might be experiencing. And at the very top, there's also a place to gather more information about that injury. So then, as a provider or an educator, you can make a better assessment about whether you think this is something that could be causing a child's behavior or educational challenges, for example. Go ahead, Maria. So that's our first work group, and our second is educational practice. And this is led by Erica Hagen, Dave Kracke, and Julie Harbauer-Krupa. And this group was tasked with summarizing and analyzing or comparing return to school laws across the US. There was a paper that was published in 2016 that several folks from NCCBI were a part of. And in that paper, they reported about 8 states that had return to learn laws. And this project is updating return to school, return to learn laws based on current legislation. And it is also still a work in progress, but we have updated to 13 states that have mandated return to school legislation. Maria, will you go forward for me? I think I have more information. And the group who's working primarily on this paper, this project right now, are qualitatively coding the specifics within the regulatory code. So they're looking into the details of the legislation or the regulations to see what types of language is common across these different states, or what might be unique to one state compared to another. And once this is compiled, we will share this through NASHIA and also disseminate it through presentations and publications. Next slide. Another project that we have worked on together was a project that Susan Davies led, who is a member of NCCBI at the University of Dayton. And again, several of us also on this project, where we wrote a paper that has been published in the Journal of American Academy of Special Ed Professionals, talking about eligibility determination for students with traumatic brain injury. And this we also presented last spring at the North American Brain Injury Society meeting, and was also presented in Eugene at the NASHIA State of the States meeting. Next slide. I'm gonna turn it over to Melissa.
Okay, so we have recently met with our existing members and developed goals for 2025. And they are to work on early education identification. So we know through interviews and qualitative research that young children are frequently underidentified with brain injury and come into elementary school with sustained symptomatology and are not getting identified by the special ed system. So we want to work on that. We want to put together Galveston resources from the 2019 meeting that were developed for parents, school staff, healthcare providers, and students, and get that disseminated through the special interest group. We want to develop a screening measure to pick up if a child is exhibiting new issues. And we also want to work on early periodic screening for treatment with youth involved in the juvenile justice system. And CBERT has screening right now that's being piloted for validation that we might be able to build off of. So that's kind of exciting. That's, for me, that's the most exciting one. And then we want to include case management screening for those who are Medicaid eligible. And so these are our goals for 2025, and we would love to invite any of you that are interested in working on these to either join NASHIA, and then by proxy join the special interest group and work with us going forward. We need more help. It's a huge job.
And I just want to add one thing. I forgot to mention earlier that when the NCCBI group, right when NCCBI started and ran for all those years, before it became a special interest group, it was run by Judy Detmer, or led by Judy Detmer, Drew Nagel, and Ann Glang. Those were the three
And-
coaches at that time.
And Drew is on the call, so you'll see him in the participant list. So thank you, Drew, for setting it up for all of us. We appreciate that work.
Absolutely great point, Brenda.
Are there any questions from anybody?
This is how you join. If you go to this website, you can join NASHA, and once you do that, there's options to join the NCCBI group. And again, we're happy to answer any questions. You can email any of us directly. Our information's on the first, believe the first slide, where you can reach out to any of us and we'll be happy to answer any question. There we go. The last slide.
Sheila.
I knew I saw it in there.
Yep.
I'm thinking people are ruminating on what you guys have covered, and I'm betting some questions are going to pop into the chat as they're thinking through, because that's a lot to digest. Y'all covered a lot of information.
Absolutely. I know. Sorry, we were faster than we planned.
I think, but the other thing is that for all of you who are on and listening, it's about collaboration. And if you have ideas or thoughts about what needs to be done, we all have a different experience in what we're doing. And some of you might have I know you do have amazing insights that might help us and give us some direction. So if we're missing anything and you think this really needs to be addressed, let us know. And we can always start working on different projects.
I see a question. I told you, people just take a little time typing. Can you explain more about the juvenile justice portion? That came from Anna.
Do you want me to do that one, you guys? Yeah, so what we suspected based on the adult research around justice involved people, which says, and somebody correct me if I'm wrong, but anywhere from like 40 to 80% when you look at that research of justice involved adults have a history of head injury. But there's not really much research done in the juvenile portion. And so one of the things that CBERT has been involved in is we worked with Alaska, and Sina's on the call too, so Sina can chime in if you want to, but we worked with the Department of Mental Health, CDC, and Department of Human Services, and the justice system in Alaska to create a screener, because the screeners that we all have are adult based. So there was nothing specific to the juvenile population. So we created it's a 5-question screener, and it's been piloted in Alaska and then Oregon. And what we found is there's about, Sina has more data, but about 30% of the kids that are justice involved screen positive for a history of brain injury or currently being symptomatic. 34 in Oregon. Yep, Melanie's on too. So Melanie's in charge of it too. So what we're finding is that a lot of kids have a history of it and many are symptomatic. And so what happens in both Alaska and Oregon right now is that all the probation officers are doing this screener, and then if the child screens positive for being currently symptomatic, Melanie and Sina and Sarah in Alaska, they reach out to the schools and out to the families and help create a intervention plan to get that child back to school successfully and have in place the accommodations that they need. And so we are looking to expand that and have NCCBI pick it up, because the reach of NCCBI and NASHIA is greater than just any of us alone. And so putting that work through this group, we're hoping to expand that into the rest of the country and get kids the services they need.
That's great. And I see some other statistics in the chat. 34, as you said, 34% from Melanie in Oregon. And then I saw from Drew, Pennsylvania, 49%.
Yep. It's a high percentage, and there's just not a lot of research done in that area. And so we really need to create a tool that can be used across the board that finds these kids, and then utilize that to create some research that we can actually publish and put out so people know how prevalent the problem is.
Definitely. I see from Susie, when working with schools, does this also extend to early childhood settings or elementary, middle, high school age?
Can I start that one? So it crosses all of these categories. Susie, thank you for that question. Erica Hagan, who is on our educational standards work group, she is particularly interested in early childhood education. She was a school psychologist for 25 years before coming back to do her PhD. And her dissertation is looking at the knowledge and experiences of early childhood providers in Ohio. So looking at, I'm not going to be able to name all 4 categories, but licensed preschool teachers, daycare providers, special education, early intervention providers, and there's one more group that I'm missing. So she is looking specifically at the knowledge that they have in surrounding young kids, the youngest kids with brain injury, and then what their experiences and training might look like. So we certainly think that is a really important part, because it's one of the highest risk groups for traumatic brain injury specifically. And they're then going to enter our, compulsory education, K through 12th. So that is very important. And that is certainly something we're thinking about. Anyone have anything to add to that?
That's great. Thank you. I see from Michael some information about a collaborative in Ohio with the Coalition for Education of Children with Disabilities. Thank you, Michael. And then from Martin, thank you for the emphasis on identification. In Maryland, they have historically found response from legislators. Department of Education has been sympathetic, but the response is it's a low incidence disability, which we know is not the case.
So we get that, all the time. And Melissa, she runs CBERT, and they have TBI consulting teams. And at Brain Steps in Pennsylvania, we have consulting teams, and we work with our departments of education on this. So we have their support. But even so, it is still a low incidence disability in the schools. But when you hear that, that means it's a low incidence disability in special education. It doesn't mean that these students, there are many reasons. They may not be identified as needing special education, but they could still have changes that impact them. Or impact their learning. Maybe a student was gifted prior to their brain injury, but now after their brain injury, they are performing in an average range, but it just takes them so much more effort. A lot of those students do fall through the cracks, unfortunately. Or if they do get identified as needing special education, it could be under a different disability category and not brain injury, because there are 13 disability categories under the federal special education law. But what we're seeing, especially I'm talking Pennsylvania, is the students with brain injury who we are supporting, who are having issues when they return to school, are in general education for the most part. So this is really, we need to kind of change the shift to, this is a general education issue where some students need special education, but the majority may not. But that doesn't mean that they don't need a 504 plan for accommodations, or they may not need, a behavior plan for, more structured behavior support specific to brain injury. So,
or mental health support, because when you take one of those kids that was very athletically talented or gifted, and then all of a sudden that is taken away from them, you start to see the mental health issues arise. But special ed doesn't really have a mechanism for addressing mental health issues. And so they don't qualify for special ed, yet they certainly need help and they certainly need services. But the school system doesn't really have a system to address that, or like what am I looking for? I'm looking for the word, a path for those kids to go, right? So the school systems frequently don't work with the outside agencies that would provide that mental health support for the kids. And so they're just kind of floundering. And 504 doesn't really address that as well either. And so there's just not a mechanism for that.
when you meet with your departments of education, it's really important to bring up these nuances of brain injury, and because it is different. We support students differently in many ways, but in many ways similarly to how we support other students with other, who struggle in schools. But it's definitely important to talk about here. We know how many students are sustaining brain injuries. So if you could get those statistics from your state for children, present that, and then talk about here's why our special education numbers could be low based on what the literature tells us, lack of training for educators, lack of identification. Parents don't always want to tell the school about a prior brain injury. They want to return to normalcy. And talk about how that is an issue, but it's an under-identification. These students are being misidentified, under-identified, and it's a gap. There's a huge gap that ethically we need to fill, and these students should be receiving supports whether they qualify for special education or not. if they're still experiencing symptoms, signs after their brain injury, chances are it's impacting their education in some way.
Well, and there's a barrier in that physicians can't freely disclose to the education system that a student has experienced a brain injury and to watch for this. So it's very reliant on the parents. We actually are piloting a system in Southern Oregon where the physicians are handing out little like postcards with QR codes for the parents to self-report to the school. So all they do is they scan the QR code and then they fill out, it's a Google form, and it goes straight to the Southern Oregon liaison. And then she reaches out to the school and the parent, and it bypasses the HIPAA FERPA requirement from the physicians. And it's seems to be working. I mean, not all parents want to self-identify their kid as having a brain injury, but those who want help can reach out that way.
Can I tag on to something that Brenda said too? I think another problem that we are sort of talking around is that we don't actually have great numbers that our states can give us, at least consistently, to tell us how many kids are experiencing a brain injury every year. We did a small project where we tried to collect this data from 6 different states, and we couldn't do it because states report these numbers differently. It's not a required reporting, and numbers that the CDC used to get were based on only people who reported to an emergency department. So it missed everyone who went to urgent care, went to their pediatrician, reported to the school athletic trainer, or didn't seek any medical care. And the numbers across states they're very different. So some numbers, they're grouped differently, so we can't match them to the special education data. Or they include things like neurodevelopmental diagnoses. So, NASHIA, that's something that potentially we could talk about, how could we work together to create better systems to collect and report this data? Because I agree with Brenda, it's important to say this is how many people have it. Because that then helps support our case to say we need, money, we need programs. But if we can't really get that data, that makes it harder.
I love that. I love that. And I see a lot in the chat also about mental health services, which makes me, this is just a suggestion I have for y'all. What about adding a goal related to screening particular to mental health needs? That's a particular focus NASHIA has. In fact, in March, I've got a slide in here we'll get to in a bit, for the certified community behavioral health clinics, and the need, to connect with them related to screening in community. I don't know much that's going on particular to screening with children and youth. And, maybe that's another way to get at numbers, kind of moving through that backwards.
Well,
Yep, mental health
term-
need. Also, a child has a brain injury. So something else maybe to think about.
Yeah, in terms of mental health, Siebert just submitted for a grant to develop an intervention for parents of children who experience TBI that have sustained symptomatology longer than 3 weeks. So it's designed specifically to teach the parents how to talk to their kids about mental health, because parents don't know how to do it, right? It's hard to ask your kid, how are you doing? Do you have suicidal ideation? Are you depressed? Like, people don't know how. And so what we're proposing doing is creating an intervention for those parents, like a course for them and tools like forms and whatnot, so they can learn how to talk to their kids and then what to do if that child identifies as, yes, I've had a TBI and now I'm starting to experience mental health problems, and how do we keep these kids from going down that route. And so our fingers are crossed that gets funded,
Right.
because I think it's so needed. and there's just nothing. And there's so many providers who won't see a person who has experienced TBI and then has depression or anxiety or suicide ideation or any of that. And so our goal is to teach the parents how to identify that in their kids.
Great. I saw a request for the screener, and Melissa, I saw you answered that. We're happy to get that information out to y'all. I see Sherry has asked about the ongoing research in Ohio and some information there. I'm just, quickly going through here. A long-term study about youth involved in sports concussion that Anne asked about. In New Jersey, we see students that don't have an IEP that are included in the data, and dual diagnosis students aren't captured.
Absolutely.
Right. And I'll say every state does that differently. Like some states, they only count the primary eligibility, not the secondary eligibility. And so the data is completely inconsistent from state to state.
Yeah. Then Shannon made a comment about exploring associated behaviors. Thank you for that. Sheila in Arkansas is talking about screening within juvenile detention centers. Definitely wish you luck there. I'm guessing you guys are seeing these as well. Anne is also talking about within an IEP, whether it's an OHI or an LD, not identifying the true underlying issue. That happens, I'm sure, all the time. Martin is asking whether or not you have any thoughts about getting information to school psychologists since they're so integral in the identification process.
We
Any
have,
thoughts?
if you go to returntoschool.org, and I think Brain Steps, both programs have tools and forms for school psychologists specifically. So Brent, I can put those links in the chat.
Yeah.
Right. Wendy, I'm reading through what you sent. She's currently working with a well-resourced family of someone who's just returned to school with severe brain injury. The school staff forget that he has an issue and have not accommodated his needs since they don't see them. They're going to be meeting with the school team. He has a neuropsych evaluation spelled out, but they don't know what they don't know. Yep, absolutely. Autism and brain injury.
Maria, in terms of the school psychologist
Mhm.
piece, I frequently get this question from school psychologists. And it's like, why should I bother to do the more extensive evaluation if I could do the easier one and make them LD? And on the returntoschool.org website, there's an answer to that question if you go to tools.
Right. I know just recently we've had a few states ask about that overlap with autism and brain injury. Susan, I'm glad you brought that up because it's come up in some of our state calls. Any comments there you guys want to make?
Yes, I could tell you in Pennsylvania, our Department of Health, are looking currently and working with a work group here in the state, looking at what do we know? What does the literature tell us already about the overlap? What are the differences? What are the similarities? I don't know where that stands, but it is something we get a lot of questions about. And also, we get a lot of questions or a lot of students who are misidentified as having autism, but really it's a early childhood brain injury that just is presenting as autism, and it may get picked up later.
Yep, or ADHD.
Yeah, or ADHD.
Mm-hmm.
And if someone was asking the right questions about You know, has your child been involved in have they ever lost consciousness? Have they ever gone to the hospital after being in a car crash? All the different ways you could ask that on screeners. If someone had asked the right question and had that piece of information, they may have looked at that differently. So screeners can really be helpful there. The other question I get a lot from schools in relation to students with autism and brain injury, and I'm sure you have heard this too, Melissa and Jenny, is, when a student with autism who is wearing a helmet because they're banging their head, we get questions like that all the time. Like, how do we stop that? Is it causing additional brain injuries? And so that's definitely a gap. Because, if you're hitting your head repeatedly, it's not good.
Well, yeah, and even if they don't have concussive syndromes, they might have micro concussions that aren't symptomatic.
True.
Yep.
Well, we appreciate it. Thank you so much for sharing all the information you've shared. And as you can see, it's quite a robust special interest group. And if you are passionate about children and youth and brain injury, it is clear to me that this would be something that you would consider being a part of for sure. We just appreciate you guys sharing your passion and interest with this topic. We just have a few more slides to share before we close out, and I've got a link to the evaluation for you to share as well. And a few things about what's coming down the pike. We hope that you have enjoyed today's webinar. This is a list of what we hope we will be covering for the rest of 2025. So stay tuned for what we are going to be covering soon. And I referenced this area in terms of supporting people with brain injury through the Certified Community Behavioral Health Clinics. Join us in March for this if you want to know more about what's going on there and have some dialogue related to planning with this intersection with brain injury and behavioral health. Of course, we'd love to see you in October in Maine for our annual conference. We will be having an intensive that is a half day that is focused on children and youth. So for sure, we would love to see you for that. And if you have a session you'd like to propose to be a part of that, feel free to submit that. There's still plenty of time. And we just appreciate you joining.
Maria, I'm already getting emails from people who are telling me that they are joining.
Awesome. That's
So
great.
thank you all for that.
That's
Yes.
fantastic. We'll be in touch. Melissa and
Definitely.
Brenda and I work hard to try to keep ourselves together. So it won't be, in the next week, but we'll be in touch soon.
Outstanding. You know where to find all of us. Go ahead and complete your evaluations, if you will, before you jump off. And we look forward to seeing you on other training opportunities. And we will put the link for the slides and the link to the recording on our website later on. So thank you so much, and we appreciate it. Have a great rest of your day.
Thanks, everyone.
Bye-bye.